Hi, everybody. Welcome to our webinar today on why do my eyes look so tired? My name is Lisa Grunebaum. I'm a double board certified facial plastic and reconstructive surgeon. Just a little bit about that. It means I have a background in ENT, otolaryngology. That's what I did my residency in. And then I went on and did a fellowship for a full year in facial plastic surgery, and that's been the focus of my career for the last 20 years. I also do research, and I sort of focus more on in-office based items, such as the things that we're going to talk about today. So we can just get started. So I have to think how to. So another thing, please don't take pictures of our slides. I don't mean to be draconian at all. Every picture that I use is used with consent or basically from Shutterstock, but I really prefer if you don't take pictures because those patients have really been kind to be nice to us, but we don't want them to be duplicated unnecessarily. But you can also follow me on Instagram at Dr. Lisa D. Grunebaum for anything more that you want to learn or to reach out to me. So when I look at a face for my whole career, I've always thought that the face is basically in three layers, just like this beautiful chocolate cake. So for simplification, we can say that the outer layer would be your skin, the middle layer is soft tissue, also muscle, and then the deeper layer would be bone. We can treat all of these layers, and we're going to talk about them around the eye for maximal results. So layer one again would be the skin, layer two, fat and connective tissue, and layer three, muscle and bone structure. So I love these pictures of layered cakes because we're going to start with the first one. That is, if you look at on your screen, you have this, it is still a fluffy, beautiful cake, but it's not nearly as good as the one with frosting. So unless you treat the outer layer of the skin, the frosting, then you're not going to have as good of a result. So let me make sure I'm going forward here. So this is a picture of a young eye and an older eye. And let's back up a little bit and talk about what's going on with this skin. Quite a bit of things are actually going on. So to young eye, the skin is very smooth, no wrinkles, no change in pigmentation. And the younger and the older eye has wrinkles, shallows, hollows. And we're going to talk about all of that today, but starting with skincare. I try really hard to focus on medical grade skincare. That means that these are products that are well studied. That means that they've gone through trials and that the companies have really looked to make sure that they're effective. And many of them are developed with our colleagues, dermatologists, eye plastic surgeons, facial plastic surgeons, and others who are experts in the field. So for the eye, my number one favorite is the Restorative Eye. Interestingly, and we're going to come back to this, there's actually evidence, and I put this paper up, that if you use the Restorative Eye both before and after blepharoplasty, you have a decreased risk of swelling and bruising. So patients actually heal better when they use very specific medical grade skincare. Pictures of sunrises and sunsets. So another thing that's really a focus of mine is when you're going to do a good skincare regimen, I like to focus on what you're going to do in the morning and what you're going to do at night, but keep it as simple as possible. So again, my morning choice would be Restorative Eye by Alastin, but another product I like you can buy in the pharmacy. So it's not just something that we sell or something that we're trying to promote. I also would encourage you to look at really good skincare that you can find in the pharmacy, and I can always help with that. I really enjoy that. So this retinol correction line smoothing, I have no association with them, but I think it's a great retinol night. Let's move on to neuromodulators. I don't know if you've ever heard that term before, but neuromodulators are things like Botox. But because there's so many out there, we don't only use the term Botox. So neuromodulators are injected into muscle to weaken its movement. But I'm going to talk a little bit more about that. I think a lot of people don't really understand how neuromodulators work. They think that it's like a wrinkle eraser, but that's actually not how they work. So here's a little picture that I want to show you. What you're looking at is the muscle around the eye. It looks like a little circle that we treat with neuromodulators. And then you're looking at a diagram of a nerve talking to a muscle. So interestingly, what happens with neuromodulators such as Botox or others is that the message from the nerve can't reach the muscle. And it neither hurts the nerve nor the muscle. And unfortunately for all of us, what will happen is the nerve will outsmart the neuromodulator and grow back its sensors. So that's why it doesn't last forever. But importantly, we have to remember that when we're treating with a neuromodulator, we're not actually treating a wrinkle, we're treating muscles. So that actually makes it a great home run around the eye. It's really wonderful. And I think it's one of the places where patients are absolutely the happiest when they get treated. So if you see that circle muscle and then you see the diagram of the lady smiling, when you smile, you create those wrinkles around your eyes. But if you can see the little X that I put in the diagram of the muscle, if we make that muscle a little bit more relaxed, the wrinkles don't show up. So again, it's a muscle treatment, but it's not a wrinkle treatment. The wrinkles are like an added benefit. And then I made a little red arrow for the brow. This is an area of some confusion. None of the neuromodulators, including Botox, can actually lift anything. What the neuromodulator does is it makes the muscle that's pulling down on your brow not work. So it goes up. So again, there's no true lifting power, but it does, I call it a brow release. So you can get your brow to move up with the neuromodulator. It's also very, very difficult to overdo. So that's also another wonderful thing around the eyes and the brow. It's very almost impossible to overdo if you use correct dosing for the brow or around the eye because of the way that that muscle works. Here are some pictures from our practice looking at before and after with neuromodulator. So again, that muscle right underneath that skin got relaxed enough that the wrinkles are no longer there. And here's another one in a female where, again, after treatment with neuromodulator Botox, all of the wrinkles got relaxed away. So I don't know if there's any questions out there for about any of this. We can stop here. We can come later if there's any questions. We're just going to take a quick look in our webinar and see if there's any questions from anybody. Okay, and we can always come back to questions if anybody has any. So now we're going to move on to discussing under eye volume loss. So in the under eye, if you see the picture of sort of the older eye, you can see there's a hollowing under the eye. I think one of the things that I want to pause on now is the idea of fillers. There's been a little bit of negative discussion about fillers lately. And I think the idea of the naming of filler is really an unfortunate name because fillers really are not meant to fill. They're meant to create contour. So I included this picture that I took this weekend in Flagstaff looking at shadows, so areas of light and dark. If you look at the picture of the woman, we want light to bounce off under your eye. So the way a filler under the eye could work is by creating a new contour, not by filling something up. So I know there's a lot of fear out there about using fillers, but in the right hands where it's considered a contouring agent, it can be very, very effective, not overdone, but you're just trying to look at the difference between light and dark areas. Areas that capture shadow under the eyes, such as areas that have a depression or volume loss, are going to look more aged than a youthful eye. So again, can reduce the appearance of dark circles, improve the look of hollow eyes, smooth out wrinkles because you're filling in, and correct facial asymmetries. Pretty rare that you can perfectly correct facial asymmetries, but you can definitely balance and harmonize the face wonderfully. Using fillers, again, maybe we need a new name for filler because it's really not just filling things up. So people sometimes are like, oh no, this is too scary. I don't want anything near my eye. Shockingly, the under eye in terms of risk is in some ways lower than other areas. I'm not saying it's without risk. There's some risk of swelling, bruising, lumps, very common. It's rarely, I've never personally seen an infection under eye. And then there are other things like getting in a blood vessel. However, under the eye, there are very few blood vessels, and the complication rate in the right hands is lower than you might think. I think it's normal to fear somebody sort of coming at your eye with a needle. But first of all, I don't use needles under the eyes. I use blunt cannula. So there's no needle near your eye. And additionally, the risk profile is actually lower than some areas that might to you seem less scary. These are some examples from our practice of using filler under the eye. We call this the tear trough because it's right under, and you can see that instead of there being shadows, it becomes nice and smooth. Here's another example. Additionally, darkness under the eye tends to be a big concern of people's. Darkness under the eye is actually commonly blood vessels. It's not pigment, or it's a shadow from a deepening. So again, we can camouflage that darkness. We can't get rid of any of those small blood vessels. Those are very importantly. But if we can camouflage the darkness with a filler, it can make light bounce, just like that picture I showed you in Flagstaff or of the beautiful young lady, where if it's smooth, the light will bounce and will look more youthful and brighter. So we're going to talk now about a few other treatments that we offer. And I forgot to tell you that this entire webinar is meant to give you options all the way from the least intense, like skincare, to more intense, like surgery, which we're going to get to in a moment. But I always try to consider, what is it that you want? Are you wanting to do something a little bit less intense with less downtime? That's fine. I always want to work with what are your goals? How can I best serve your goals with what it is that you seek by way of downtime or other concerns? So SofWave is a great treatment and actually approved for brow lifting. It's non-invasive skin tightening and wrinkle reduction, and there's zero downtime. So let's look at some pictures because I think in this case, the pictures are worth 1,000 words. I've personally had SofWave done for myself as a gift I gave myself for my 50th birthday, and I had no pain with my treatment whatsoever. So here are some before and afters. If you just focus in on the brows, this is non-surgical, non-invasive, using SofWave technology to pull the brows up through skin tightening. And here's another one before and after where there is a lift of the brow, again, non-surgical, non-invasive in office. I personally had no experience of discomfort with my own treatment. Another one. So Fraxel is probably, again, moving along our spectrum here of things that are least intense to a little more intense. Fraxel is the brand name of a laser. It's also minimally invasive, so none of the skin is taken off, none of the skin is hurt. And it's a non-invasive resurfacing treatment. And what it does is it pokes tiny little holes of special energy right into the deeper layer of skin, skipping over the top layer. And then new collagen is produced. Additionally, there's a little shuttle bus that actually takes some of called a melanin shuttle, and melanin is the pigment in your skin. So if you're concerned about brown spots, those little micro treatment areas actually have a little shuttle bus that takes the pigment and removes it. And that's very, very special about the Fraxel wavelength, which is the specific kind of laser. So almost all skin type can benefit. It treats fine lines, somewhat deeper lines, pigment, and other skin concerns, and you can see results in just 1 to 2 treatments. So here's some other pictures of Fraxel. You can see improvement in the brown, improvement in the fine lines and wrinkles after this treatment with this laser. This is another picture of a patient of mine that was treated. Again, please do not take pictures of my patients. And you can see large improvement in all lines, wrinkles, and brown spots. This was not with the Fraxel, but with a different laser that I'd be happy to talk to you about at any time. So now we're going to move on a little bit to surgical treatments. So surgical removal of upper lid extra skin and sometimes a small amount of fat in office is a great option for opening up your eyes. And we're going to talk a little bit more about that with a patient of mine in just a moment. I want to pause here and encourage you to consider if you'd like to be treated with any of these options. These are specials that are only offered through the webinar, and it's good till 4 p.m. tomorrow. So just so you understand how the office makes this work, so you pick one from each category. It's not a mix and match. It's just a one from each category. So you can have on the device solutions, the Fraxel eyelid lift. So the Fraxel is the laser that I was telling you about. That's great for wrinkles and pigment. I showed you pictures of the Softwave brow lift. And then the Agnes is yet another treatment that actually includes skin tightening. The injectable solutions, this is my particular favorite choice for a syringe for under eye. I also forgot to mention that I was one of the first people to help lead FDA approval for under eye fillers. I ran one of the trials that led to approval for filler under eye. So I consider myself an expert in that because companies have trusted me to help them get their products approved in a very improved safety and efficacy. I like to use Redensity under the eye, and so a syringe of Redensity under the eye is usually enough to treat. 2 might be needed. Somebody has a raised hand, so I need to look at that in 1 second. And then additionally, we are offering 60 units of Botox or Xeomin and 100 or 120 of Dysport. I'm going to get back to that question, but I can answer it. Let me finish the complimentary add-ons, and I love to answer questions, so give me 2 seconds. So additionally, these are free and included the Elastin Restorative Eye, which I talked about, which has amazing evidence, and a sun protection kit. So it says, I just joined in. I think we're talking about having success when people are using it. Oh, this is such a great question, and thank you to the individual who posed this. The question says it pushes the smile line into a different unnatural line. So I think that can happen. I'd have to assess an individual to understand more. I think it's one of the good reasons for seeing a board certified cosmetic physician, because we have a really great understanding of anatomy. So remember that circle muscle that I talked about? If the skin of the cheek hits up against a relaxed circle, it can certainly make the skin of the cheek look a little bit odd because it's hitting against. So usually when you have that outcome, it's because there's extra skin on the cheek, not because there's necessarily an issue with using neuromodulator around the eye, but that would need to be assessed individually. And I would never make a promise that I can't keep, but commonly we can work around that. There's usually a trade-off by saying, okay, well, some of the lower wrinkles might be left behind, but that unnatural outcome may not be there. So I think I just want to go back for 1 second to this slide. If anybody has any questions about the slide, you can let me know. And I love questions, so please keep them coming. That's wonderful for me. So I'm going to move forward to the next slide. So there's also a raffle today, and all attendees will be entered to win a raffle. And there's a product bonus if you want to come see me. The first 10 patients to make a consultation appointment are going to receive a Skin Better medical grade skincare gift. Okay, now we're going to move on to another really fun part of our presentation because I have with me right now this patient that you can see a picture of. She's a patient of mine who had in-office surgery for brow and upper lid. And so we're going to move on to ask her some questions. And also you should feel free to ask her questions about her experience as well. So I'm going to just show you a couple other pictures of her that's going to let her, we're going to let her talk about it. So we're going to just take a second to put her in the screen. Okay, so this is my beautiful patient, Anne, right here, and she's gonna answer some questions about her experience with in-office eye surgery. So she had in-office eye surgery within the past few years with me. And my first question to you is, what was it like? Did you have pain, experience anything?
Thank you. No, I have to tell you, it was pain-free. It was super easy, and you can see the results. I feel like I look like a totally different person, and I'm just very grateful. It was very natural, and I would recommend it to anybody.
So when we do in-office surgery, we don't actually use any kind of injected anesthesia. We do use a relaxation medication, and we do use local anesthetic injected around the eye, but there's no true anesthetic used. So that decreases some of the risk that can happen with anesthesia. That's not some people don't like it that way, but the vast majority of people prefer to reduce the amount of sedation that they receive for this surgery. Another thing I want to point out about Anne, and it's true of many, many people, her eyes are her signature feature. So she's got these beautiful blue eyes. And unfortunately, with the maturation process, sometimes the signature feature gets a little bit more um, clouded over or not as popping as it was prior. And so that's another really good motivator. Did you feel like that happened with you?
Yes, because I'm definitely not a tall supermodel, but everybody that would see me would say, "Wow, you have such beautiful eyes." So that was definitely one of my strongest features that people loved when they'd see me. And the transformation, like you can see, it was just night and day. So I'm very grateful for that.
Okay, so we also included a picture of Anne and her mom, and you could explain why you included that picture
Oh,
with your
sure.
mom.
So that's my mom, and we also have a second home in Hawaii. And after the procedure, that was about 2 weeks after. And as you can see, I wasn't, I didn't even have to wear a scarf. I didn't have to do anything. I was just so thrilled with my results. And we went back to the island, and everything was healing perfectly.
So I prefer for people not to travel away from the office for approximately 2 weeks. It could be a little bit less if you're having an upper lid only surgery without brow, but with brow, it would probably be 2 weeks. The reason for that is basically it has to do with sutures and making sure you're in the right healing process. But again, there's Anne on the plane to Hawaii with her mom 2 weeks after lid and brow surgery. I would add that the sutures that I use on the upper lid are absorbable, so they don't need to come out. They go away on their own. Because of the amount of lift that we want to put onto the forehead, again, using a natural eye, there are sutures and staples in the forehead. For most people, half come out at um, 10 days and half come out at 14 days, but some people heal slower or faster. I do have a question that I'm going to try to answer. Then I have a last question actually for Anne. So the question was, what was the exact procedure? So the exact procedure was upper lid blepharoplasty. So that's removal of extra skin on the upper eye, and then brow lift. The way that I do brow lift is an incision into the forehead. And if you want to learn more about it, I'm happy to discuss it with you in consultation. But if you look at her forehead, you cannot see the incision lines at all. And she has her hair pulled back, actually, in the picture in the airplane. And actually, the incision for the brow lift was right along the hairline, all the way across to allow me to get under all the layers of the forehead and brow and lift it up together, which I personally believe is the strongest way of getting a brow lift. So just to repeat, Anne had a brow lift and an upper lid blepharoplasty. And what was the best thing about your surgery?
I really think it took years off my face, and I'm outside probably 4 hours golfing, 2 hours playing tennis. So I'm really hard on my body, my face, and I just felt I looked like myself, but it took years off, and it made me feel just wonderful. So I'm grateful. That was the best thing I've had done. So thank you.
Oh, well, you can imagine it's a total pleasure to take care of Anne. The pleasure is all mine. It's just such a great joy to help people feel like their best self. That's just one of the greatest joys as a physician. Oh, this is a question, and you can decide if you want to answer this. The question is how old you are.
55.
Okay. I love these questions. Are there any other questions that people have about anything to do with this surgery? And that's another great question that I should touch on. Some people who are younger benefit from these surgeries because they have genetic predisposition to feeling like their eyes are hooded or crowded. So it can be a good procedure for anybody who has the right underlying motivation from younger to older. Individuals who have especially blood pressure issues or other medical concerns are not good candidates for in office because we want to be very careful with those things. So if you have other health problems that would need to be discussed and consideration for maybe doing it in an operating room. But for most healthy people, it can be done easily in the office. So, this is another wonderful question. Okay, how long should you avoid other treatments? I got a phone call today from a different colleague saying that she had a patient in office who wanted to come in for a bluff. How long did she need to wait to avoid, for instance, neuromodulator? So again, that would be Botox, Dysport, Xeomin, or Daxxify in our office. My answer would be 3.5 to 4 months. And that seems a little bit long, but I'll explain why. Anytime you have any of the neuromodulators in your upper face, it can affect the position of your brow. And when we make safety measurements for how much lid can be removed, and that's very important. I always say the most important part of the entire surgery is beforehand when we mark to the limit of safety, and we never go beyond that. If your brow position changes in any way or your eye around your eye position affects my ability to make proper measurements, that could lead to an inappropriate amount of skin under not enough being removed or too much, and we would never want that to happen. So I really appreciate that question. Another question is lazy eyelids. I think the question is about something called ptosis, which means that the lid on one side or both sides approaches the black little dot in the middle of your eye, your pupil. That so upward bleph can be done for that, but that's separate and it's a medical procedure. I don't personally offer that, but if that is a concern of yours, I can certainly send you along to an expert in our community for that. Another option, which we do have, which a lot of people love, is a drop called Upneeq. It's a non-surgical solution for lazy eye where you put drops in your eye. That is a self-pay drop and it works wonderfully. I actually use it for vanity reasons. Like if I want to make my eyes look even more open than they are, sometimes if I'm going out, I'll use Upneeq, but it's also designed to help with this, what we're calling lazy eye or ptosis. Are there any other questions from anybody about anything to do with the presentation or eye rejuvenation? I don't know, Anne, did you have any other questions?
No, it's been, I would say it really has cut down when I have had to come in maybe once or twice a year just for my general Botox because my forehead obviously is going to move a little bit. And so, like I said, everybody that I know after I had it, and even now, they keep remarking about my eyes because it really does make my eyes pop.
I don't necessarily like to use people's names, but there's an individual who just asked, I asked a question in Q&A. Did you see it? No, that individual, I did not see your question. And then there's another question. If that individual who asked me that question wants to repeat it, I will do everything in my power to answer it. The name of the drop for lazy eye is Upneeq, Upneeq, and we have it here at Clearderm. The next question is about, Bell's palsy. That is a wonderful question. So, concern about using Botox or neuromodulators in Bell's palsy is sort of a complicated question, but let's talk about it. So remember we talked early on how Botox or neuromodulators stop the message from the nerve getting to the muscle. True Bell's palsy also does the same exact thing. So in recovery from Bell's palsy, which can be up to 1 to 2 years, we try not to necessarily use it for facial symmetry, although there may be other medically necessary reasons that Botox can be used for individuals who suffer from Bell's palsy. And this is another webinar that I could do, but it's really more for individuals who suffer from a medical problem, another expertise of mine, but I don't want to leave you without an answer. If you're fully recovered from Bell's palsy, and I would look at those records. My background in facial plastics includes an expertise in certain facial nerve disorders, and make sure that I feel confident that your Bell's palsy has been fully evaluated and treated. There, you can go back to safely using neuromodulators. I will add just one more thing in. If you have an unwanted effect in your recovery from your bowels, like you have one area that moves when another area moves, those are good reasons to have medically necessary neuromodulators such as Botox. And there was one other person who said, I had no idea that a brow lifter upper eye could be done in the office. Yes, it can be done in the office. Again, I don't think every single person can be a candidate for that. We want to make sure that safety is considered. That's the number one thing. So most people who are healthy are complete good candidates for in-office. However, if there's any concern about your individual health status and safety, then we would have a long discussion about that. And then there was somebody else who said they had a question, but maybe I didn't see it. But I didn't. Does anybody else want to? Okay, we did answer it actually. Are there any other questions that I can answer for anybody about anything to do with eyes at all? And if you have any questions that are lingering afterwards, you can certainly call, leave messages. We'll do our best to answer them for you. That can be helpful. And if you, let's see, there's a question about the discount. You actually have to do the package that you have to choose something from column 1, something from column 2, and then column 3 is free. I believe you can always talk to the office more about this. I present it, but I'm actually not personally involved with any of the discounting or anything like that. I'm here just to help you achieve your own goals. Let's see, there's a hand raised, so I'll try to get that to see that. No, if you want to, if you have a question for me, you don't have to raise your hand. You can just put it into Q&A. And again, I'll do everything in my power to answer it for you. Okay. Well, be in touch if you want any more, if you have more questions or anything, you can follow me at Dr. Lisa D. Grunebaum on Instagram. And I look forward to seeing you all and talking to you more about your individual goals and making you feel your best self. Thanks. Bye.
Okay.